You are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician that combines the wisdom of natural medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimal health. She focuses on evidence-based nutritional therapy for food allergies and in bioidentical hormone replacement. She is a twice published author, a long-standing member of the North American Menopause Society, and a certified menopause practitioner. We are on a mission to empower you with the knowledge and expertise that Dr. Marzell has earned throughout her career. We hope you enjoy and want to thank you for being with us today. Without further ado, here's Dr. Marzell. Enjoy the show.
Hi, I'm Dr. Lori Marzell. I'm a naturopathic physician and a certified menopause practitioner. And guess what I'd like to talk to you about today? My favorite subject, menopause. What I would like to talk about is things that may quite not be treated or given the appropriate attention in order to be treated, and that is the urogenital system. Now, that sounds very medical, but what I'm talking about is bladder health and vaginal health. A lot of patients that come in and are into menopause, if they have not been on hormone therapy for sometimes several years, they have vaginal dryness, pain with intercourse. They may have an increased tendency for urinary tract infections, and they may start noticing urinary leakage. All these things may benefit by treating women with this with hormones directly in this area. The reason why you need direct treatment is because there's an awful lot of receptors in the vagina and around the urethra, which goes from the bladder to the outside. A lot of times women come in and they've kind of gotten used to things being dry. They've gotten used to intercourse hurts, so they avoid it, or they're not in a relationship. And if they're asked about any problems in this area, they go, I essentially don't need that area of my body anymore, so I haven't paid it any attention. This is unfortunately not a good attitude because all parts of your body are important. So let me explain a little bit more. Let's take urinary tract infections. I actually attended a medical, I believe it was medical grand rounds several years ago. And they made a point that older women frequently have urinary tract infections. As a matter of fact, the presenter said that they just have them all the time. They all have chronic, we don't know why, but they all have chronic urinary infections. And so we don't even treat them anymore. So don't worry about that. If you see that in an older woman, just ignore it. Well, that sounded kind of strange to me. And I had two cases just a few weeks ago that really reminded me of the importance of women not having urinary infections. And that is that when older women can develop an infection like that, because the tissue is so dry, it has probably caused some nerve damage to the tissue. Things are not functioning normally, so they're not getting the type of symptoms that they would have had or noticed when they were 20. They would have noticed burning on urination, pain in their pelvic area, stuff like that. And because those symptoms may not be as vigorous as previously, they may just flop off, I felt a little off, but I don't know if it's anything I need to worry about. Well, the problem is, this is really super important, that older women who have urinary infections, especially ones that they don't even know they have, can manifest with cognitive problems. This is very common, and it has to do with the amount of inflammation that's produced in the body. It starts affecting their brain. I had one patient, actually, I had one patient who complained of cognitive decline. She didn't know where it was coming from, and she just noticed, I'm having more problems. I can't think of names. I don't know what's wrong with me. And so we did a checkup exam. Well, we did a checkup lab work, and we found that, things looked pretty normal, except she had a higher white count, which would happen in an infection, and she had a roaring urinary tract infection. And so we treated her, and within 2 days, she started functioning better cognitively. It was amazing. I had another case the same week, so this is why I'm making this little recording today, of a woman that I was firmly convinced had to be put in some kind of assisted living or something like that. She was totally scattered. She called incessantly. She made an appointment for a certain time, and she called about 4 to 6 times during that day to say, now that appointment was, well, it was this time, wasn't it? I don't know if I got that straight. In addition to that, she just couldn't remember anything. I was worried about her being able to go to the grocery store and getting lost and not finding her way home. And again, it's really important to start with a good, thorough laboratory exam when you're looking at people like this. And she presented again with a roaring urinary infection. So again, we treated her urinary infection, and I had her come into my office 2 days after starting her on an antibiotic. The result was I wanted to do some psychological testing with her, and so I did. But after only 2 days, she not only passed the mental testing that we did, but she flew through it. She was able to do anything. She went through all the stuff, drew all the pictures, answered almost everything correct. And you could see the ability of her brain to cognate and find answers. And that was very efficient at that time after only 2 days on antibiotics. So the danger is, if you do not look for this, people can start having cognitive problems and just think they're going crazy and ignore it, or not get evaluated, or get evaluated and nobody orders any tests that can look for this by checking a simple urine test. A simple urine test preventing you from losing your mind. Think about it, and think how many people are out there not tested. It's overwhelming. So why do older women get urinary tract infections? Because the urethral cells become dry without replacement of hormones. Now, there's 2 particular hormones that are important. One is estrogen, and it's estradiol, strong one. Second one is testosterone. This is also very important. And if these cells that line the inside of the tube that goes from the bladder to the outside, your urethra, if they do not have a sufficient amount of these cells, they get dry, they're unhealthy, and they're dysfunctional, and they can get infected very easily. Also, the pelvic sling is a big, strong muscle. It goes across the whole upper pelvic area. this has tons of estrogen and testosterone receptors. Now remember, testosterone is what builds your muscles and makes things strong. Estrogen isn't so great for muscles, not any comparison to testosterone. How many women are getting testosterone replacement in these tissues? A very small amount, because number one, it's not available at your local drugstore in a dose for women, and it can only be compounded into something to get in that area so that it gets into those receptors. So we have a problem here. And it's a problem people should be aware of. I would also like to talk about vaginal problems, so I'll make this part 2. And thanks for listening, and have a great day, everybody.
Thank you so much for listening. If you enjoyed today's content, please feel free to share with a friend and help us spread our message. If you'd like to learn more about Dr. Marzell, please visit our website at www.drmarzell.com. Until next time.